let's go to the next. Okay. So again, welcome to the March 5th meeting of the Oregon Healthcare Workforce Committee. And I'm Ian Strauss. I use he, him pronouns, and I am chairing this meeting. Next slide. Okay. So just some general housekeeping. This meeting is open to the public, welcomes public testimony. We do have a section for public testimony later in the meeting. This meeting will be recorded. Live transcription is available. And if you're a member of the committee, please turn on your camera if you're able so that we can see you. Okay, next slide. Since we've gotten to be a larger group, we're going to do roll call instead of our old-fashioned popcorn. Please give us your name, your preferred pronoun, and any organizations you might be representing. Aaron Hines. Elena.
Good morning, everyone. I have an ice cube in my mouth. My name is Elena Shablowski. I use she and her pronouns, and I'm a dentist, and I practice at La Clinica, which is a federally qualified health center in Medford. Good to be with y'all.
Welcome. Alicia. Alicia Jackson. Okay, Koi Vu. Eric Weiser. Dr. Weiser?
We see that you're here. You might be muted.
Sorry, I'm having technical issues, but Eric Weiser, I'm a family physician, director of the Oregon AHEC, and I am the assistant dean of rural UME at OHSU.
Welcome. Gabrielle Carrillo.
Good morning. My name is Gabriela Carrillo. I'm the director of clinical placement at Sumner College School of Nursing.
Welcome. Jason Johnson. Judy Geiger.
Judy Geiger, Chief Nursing Officer, Columbia Memorial Hospital in Astoria.
Okay. Kelly McKnight. Larissa. Laura Chan.
Good morning. I'm Laura Chan, she, her pronouns. I'm a third year medical student at OHSU.
Okay. And our wonderful past chair, Laura McKean.
Good morning, everyone. Laura McKean. I'm with All Care for a couple more days, and then I'll be transitioning out of All Care into a different role. But good morning, everyone. It's good to see everyone.
Okay. Manu. Manu Chaudhry. Megan Holland.
Good morning, everyone. Megan Holland, she, her pronouns. I'm a family doctor in Coquille on the South Coast for a critical access hospital, Coquille Valley Hospital. And I am Regional Associate Dean for the Campus for Rural Health on the South Coast.
Welcome. Molly Reynolds.
Good morning, everyone. I'm Molly Reynolds. I use she, her pronouns. I'm a program manager with RISE Partnership, which specializes in providing training and benefits to state home care workers and personal support workers.
And
I'd like to announce that Koi Vu is here.
Oh, great. We're just doing roll call right now. So do you want to give us your name and preferred pronoun and who you represent?
Yeah, sorry for being late, running from another meeting. I'm Koi Vu, pronouns she, her, hers. I'm the executive director of the Coalition of Community Health Clinics.
Great, welcome. Rob Ross.
Hi, I'm Rob Ross, he, him. I'm a family doctor by trade, but I'm the director of academics and excuse me, research at St. Charles in Bend.
Welcome. Bob Lieberman. I think we got a message that Bob may be a little late. Dr. Rosemary Hemmings. Okay, Stephanie Green.
Elisa Jackson is here.
Okay. Welcome, Alicia. We're doing roll call. Would you give us your name, preferred pronoun, and who you represent?
Oh, sure. My name is Alicia Jackson. I use she, her pronouns, and I am a family medicine physician with OHSU, as well as Hillsborough Medical Center, work as a medical director and associate program director for our family medicine residency program.
Hey, welcome. Surya? And Tessa Christensen. Okay.
And
Next
Ian,
one.
I think we skipped over Levi, who I see is here.
Oh, Levi, do you want to? I apologize. You want to give us?
No worries, no worries. I'm Levi Anderson, he, him. I help with community partnerships and self-sufficiency program for Oregon Department of Human Services and Grant Harney in Malheur County.
Okay, have we missed anybody? If you're a member of the committee and we haven't called your name. Okay, next slide. We also want to welcome our guests and Oregon Health Authority staff. If you would put your name and where you're from in the chat, that would be great. Next slide. As usual, we want to thank the Oregon Health Authority staff for participating in our committee work and giving us all the support we get from that group. Here's a list on the slide of some of the folks who will be attending this meeting. Next slide. So a brief look at our agenda today. We're going to go through, as usual, look at the health equity definition, move on to the February meeting summary approval, get some updates from the Oregon Health Policy Board meeting yesterday and also from the Oregon Health Authority. Then move into more of the detail of this meeting, a presentation from the Healthcare Provider Incentive Program. We'll take a short break and then have another presentation on the traditional health workers in the healthcare transformation for CCO 2.0. And then at 11:45, we're going to move into a discussion of what we're doing and where we're going this year as a committee. So get a little more input into what we're doing and how we're going to do it, including some details on the survey that Deepti sent out earlier in the month. And that should bring us to the end of our meeting. Next slide. Okay. Next slide again. So one of the practices we've had as a committee is to read the health equity definition at the beginning of each meeting, as it sets the context for the work that we do here. And so I will read it now unless anybody else wants to step up and read the definition. Okay. Oregon will have established a health system that creates health equity when all people can reach their full health potential and well-being and are not disadvantaged by their race, ethnicity, language, disability, age, gender identity, sexual orientation, social class, intersections among these communities or identities, or other socially determined circumstances. Achieving health equity requires the ongoing collaboration of all regions and sectors of the state, including tribal governments, to address the equitable distribution or redistribution of resources and power, and recognizing, reconciling, and rectifying historical and contemporary injustices. So again, this is the lens that we look through in all the decisions that we make here in the committee. Next slide. So what we here are the guiding questions for the equity framework. I'm not going to read these out today in the meeting, but please do take a look at these questions. Again, this is something to think about as we work through the healthcare workforce issues that we're dealing with in this meeting. Next slide. Okay, now we're going to review the February special meeting summary, so the minutes from that meeting.
Eric Weiser is here.
Great. Okay. And so hopefully everyone has had a chance to read the February meeting summary. Any comments, changes, updates, additions? Okay. Looks like we need a motion to approve.
I'll move to approve the February meeting minutes.
Great. And a second?
I can second.
Okay. Everyone raise their hand who can approve these meeting minutes? Whether you use your regular hand or the electronic version? Okay. Anyone who cannot approve these? Any no votes? Any abstentions? Anyone who's abstaining? I
Vote
believe
appears
that.
unanimous.
Pardon?
The vote appears unanimous.
Great. Thank you, Jessica. Looks like we're good. Okay, that's approved. Moving on. Next item. Next slide. Okay. Jessica, do we have any public comment?
None came in ahead of time. If you are a member of the public and you wish to make a comment, now is the time. So put your hand up if you wish to make a public comment. I'm not seeing anyone. No one has their hand raised.
Not seeing anyone. I think we'll just complete public comment. Next item. All right. The OHPB and OHA updates. Deepti and Neelam.
Hi, good morning. My name is Deepti Shinde. I'm the lead staff for the Healthcare Workforce Committee meeting. It's usually Melina Moran who does the updates. She is our Oregon Health Policy Board liaison, and she is unavailable this morning. And so I will do my best to give you a quick summary of what happened at yesterday's Oregon Health Policy Board meeting. So that was yesterday on March 4th. One of the topics covered was a presentation on gender affirming care provider, the work group. They presented their report to the board. There was no vote or approval required. It was a presentation to keep them updated. And the presentation went great. It was very well received. We had Ian from the Healthcare Workforce Committee and Julia from the Health Equity Committee as co-presenters, and the board received the report very well. They wanted to follow up in a few months on what progress has been made after we hear back from OHA Director Hothy about potential next steps with the gender affirming care work. After that, Dave Inbody from OHA provided an update on the CCO procurement process, the CCO 3.0. And he'll actually be giving an update like this every other month for the next, at least for the next year or so, because this is such a big process and it's quite a lengthy process. And so they talked about how, the CCO contracts, they're the largest contracts for the state of Oregon. They provide health coverage for 1.4 Oregonians, and that's about 90% of that is Medicaid. So for this process, they're evaluating CCO performance and then also resetting expectations. And especially this time around, they really went for a lot of community engagement and a process of collaborative decision making. The new contracts will be effective January 1st, 2027. And so the rest of 2025 and 2026 will be a conversation with community, the CCOs, all of that until they're actually in place in 2027. Dave also provided a preview of what they're calling a operational snapshot of each CCO. This is kind of like a progress report or maybe like a report card. And it's a point in time review of some key operational things that the CCO is doing. It's very compliance focused, and it's unfortunately not a full evaluation of all CCO activity, but it does, each snapshot includes success points, some deficiencies, and then also guidance to each CCO on how to address those challenges. OHA has been meeting with each CCO individually, just so that they won't be, surprised on anything in the snapshot. And they'll be releasing those snapshots sometime in March. No date was given, but they anticipate it will be in March. Each snapshot covers 5 areas, and it's access to care, service delivery, member rights and health equity, program integrity, and financial performance. And after I'm done with my update, I'll go ahead and link to this document so that you can see a little bit more about what's in that snapshot. The third presentation to the Oregon Health Policy Board was around the process that they've been engaged in for several months now related to CCO feedback. As you know, the board has been collecting feedback and recommendations from a really wide range of audiences. So they shared a preliminary report that shares some of the common themes that they've heard about from members of the public, provider groups, all of that. And they talked about some issues in 2 main areas, network adequacy and access to care gaps. And then the other area was health equity gaps. So the preliminary results included about 6 observations, and for each observation, it's a 45-page report, but for each observation, there are examples and direct quotes in there. So I highly encourage you to to check out that preliminary report. I'll also link to that in the chat. And to give you an example, like the first observation was that variations between CCOs cause challenges, especially when there's more than one CCO in the same region. And so the examples given were that providers are confused about what's covered and what's not covered when they work with multiple CCOs. And then another issue was that CCOs might reimburse at different rates, and that can impact the equitable access to services if one CCO in the region is paying a much higher rate than the other CCO in the same region. So at the next Oregon Health Policy Board meeting, which is in April, the board is going to really get into what specific recommendations they want to make as a board in terms of procurement. So they'll be getting more into the details at that meeting. I also wanted to mention that two of the committees under the board, the MAC, the Medicaid Advisory Committee, and the Public Health Advisory Board, provided letters to the board with their specific recommendations related to CCO procurement. That was it for the update. I'll go ahead and link to those documents so that you can take a look. Thank you.
Okay, thank you, Deepti. All right, next slide. Okay, and next slide.
I just wanted to mention the OHA updates are written updates, and they're found in your calendar invite, and then also the meeting materials. So we won't read them here. I just wanted to provide a quick update, which was that the Gender Affirming Care Provider Report was sent to Dr. Hathi last week, along with a memo that sort of introduced the report and queued it up. And so the next steps are that she will review it and get back to us with next steps. And she has sent an email, thanking us for all our work, and that she will be following up with next steps. So.
Yeah, I can add to that the response to the report was pretty amazing overall. The Oregon Health Policy Board was engaged. It was very clear that people had spent time reading and putting energy into thinking about the report and the recommendations, and we're very excited to start taking action around those recommendations. So it was very heartening to see the initial response from the board. Okay, we're running a little bit early for a change. Let me see. Healthcare provider incentive program, folks. Jill, are we ready to move on to the next item?
I believe so. We're going to pass it to Neelam, since she's the director, and give a little bit of an introduction, and then we'll get started. Yeah.
Great. On to y'all.
Great. Hi, everyone. Neelam Gupta, she, her pronouns. I'm the director of the Clinical Supports Integration and Workforce Unit here at OHA and the Health Policy and Analytics Division. And we're really pleased to provide today an overview of the 2025 evaluation report on the effectiveness of healthcare provider incentive programs in Oregon. For those of you who've been on the committee for a while, this report will be very familiar to you, but we also recognize that there are quite a few members who have joined in the past year. So we wanted to provide this introduction to this legislatively mandated report. Jill Boyd and Kim Tolchinsky, who are with the program and do such a fantastic job in administering these incentives are going to provide more detail. But we just, our intention is to kind of provide an introduction to you of this important report that is produced every 2 years, and to make sure that you feel comfortable and confident when we come back for an approval vote at the May meeting. This is one of 2 reports that is required by legislation to be produced every 2 years. And so, again, really pleased to provide this overview, and happy to answer questions either today or at a future point in case you have questions around these. As you'll see, they're very complex and interrelated incentives that these programs offer. And with that, I'll turn it over to Jill. Next slide, please, Jessica. Or Jill and Kim.
Yeah, we're going to start with Kim. Thank you.
Hi, everyone. I'm Kim Tolchinsky, pronouns she, her, and I am with the Healthcare Provider Incentive Program. And I'll get started today. Our main objective for our presentation today is to prepare you all, the committee, to review the evaluation, like how the evaluation report is going to be reviewed. So we'll be doing this by providing an overview of the report structure and background on the state-funded financial programs. As Neelam mentioned, some folks might be more familiar with the programs than others, with the overall goal of ensuring that you all have the background information about the program content and structure for the upcoming approval presentation. Next slide. The presentation is going to be separated out with first, it's going to be a lot of Jill and I talking. We'll be going over the background of the Healthcare Provider Incentive Fund and what the evaluation report is. We'll also be doing a really deep dive into the overview of all the different state financial incentive programs that are reviewed in this report, including the Healthcare Provider Incentive Program, or HCPIP, the Healthy Oregon Workforce Training Opportunity Grant Program, or HOW-TO, Behavioral Health Workforce Incentives, BHWI program, and the Oregon Rural Medical Tax Credit. I'm going to try to not use too many acronyms in this presentation, but if I get a little too into it, we can go back to this slide to reference them, or people can ask the question as we go along too. And then we'll be going into what our next steps are with the committee and OHPV, and what the timeline of the approval process of this evaluation report is going to be. And then we'll have time for questions and comments. Next slide. We're going to go into the background now, so we can flip over to the next slide. So the Oregon, our team offers state-funded financial incentives to healthcare students and practicing professionals who commit to providing culturally responsive care to Oregon Health Plan or Medicaid members and Medicare recipients. And for the students and providers who are practicing at site locations in rural and medically underserved areas of the state. And this is with the overall goal of supporting practices, professionals, and people. So it offers an important recruitment and retention tool for folks in this area and working in these areas. It also provides educational debt relief for students and practicing professionals to kind of eliminate those financial barriers associated with training and progressing in the field. And then also increases workforce diversity in these local communities. Next slide. So how did the Healthcare Program Incentive Program come to be? In 2017, the Oregon legislature passed House Bill 3261, and this requires the Oregon Health Policy Board, OHPB, through OHA and its partners with you all, the Healthcare Workforce Committee, to do 3 key things. So creating a Healthcare Provider Incentive Fund, and this consolidated multiple provider incentive programs that are either existing or new under one single pool under this fund, which is outlined in statute, and includes the Healthcare Provider Incentive Program, and which is also administered in partnership with the Oregon Office of Rural Health. It also requires requires OHA to conduct a healthcare workforce needs assessment, which we just went through earlier this year, every 2 years by February 1st in odd number years, and to provide proposals to identify and address the needs of the fund programs. It also, lastly, requires us to evaluate the effectiveness of these state financial incentives under the funds, also every 2 years, and their effectiveness in recruiting and retaining healthcare professionals to practice in these rural and medically underserved areas. Next slide. So this last requirement on that, the evaluation report, this is our 4th report of the effectiveness of these state financial incentives. The report summarizes data from the fund's inception or whenever the program started, if it was after 2018, through June 30th of last year, so 2024. As we go through, you might notice that some of the programs that have happened over the past year are not included in the report, and that's because of this cutoff deadline. And includes data on the 3 healthcare incentive program fund initiatives. So HCPIP, How To, and BHWI, which was created by House Bill 2949 in 2021 and House Bill 4071 in 2022. The evaluation also includes data on one incentive that's technically separate from the fund, but still included in the programs is Rural Medical Provider Tax Credit Program. Next slide. Okay, let's go into the timeline a little bit. So some of the folks here might remember back in May 8th of 2024, which actually doesn't feel like that long ago, the evaluation report overview, we did a presentation at one of the committee meetings going over kind of similar thing, what the background is of the programs and what the report is. And over the past year, from April 2024 to 2025, we've been doing a lot of report planning and development and data collection, and then reviewing with leadership and other partners that we work with, both internally and externally. And then we are here on March 5th. We're reviewing the HCPIP and evaluation report. Coming up in the next couple months, we have several meetings with both the workforce and workforce committee and OHPB to go through the approval process. So May 13th, we're going to be doing an educational webinar with OHPB. On the 14th, we'll be doing an evaluation report presentation and approval to the Healthcare Workforce Committee. So today is kind of an educational opportunity. Our next May 14th meeting is going to be the approval process. On June 10th, we'll be doing an evaluation report presentation to an approval by the OHPB. And then finally in June and July of this year, we'll be doing an evaluation report dissemination and approval, the broader scope. Next slide. Okay, let's dig into the different programs. Next slide. Okay, so with the number of incentive programs between 2018 to 2024, we have this broad number of individuals participating, which demonstrates the positive impact of these programs in providing access to care. So over the course between 2018 to 2024, we had over 7,000 providers offer approximately 1.2 million hours of primary care and dental care to 1.5 million patients, which is a huge scope in the world in the state, in the Oregon. And this slide is mainly to help with the committee's understanding of the size of these programs, just so you can kind of understand the scope of how many people are receiving incentives for each of these programs. And it will be available for your reference. In the next, our next meeting will focus a little bit more on breaking down these numbers and providing additional data. Next slide. Okay, so this table outlines kind of how the report is structured. It's fairly long and dense, and so I think it would be really helpful to kind of see how each part is going to be outlined. The evaluation report is kind of broken down into each of the programs that are included in the fund. All of them provide some background context. They all have data on utilization or like in participation in the programs. For Real D data, there is some fluctuations. Some programs collected Real D data. Some of them use the Oregon Medical Board or OMB data. And we'll talk a lot about this in the evaluation on how we're trying to align all of that a little bit more based on changing requirements. All the programs have a good focus on expansion efforts and what we plan to see in the upcoming years of the next evaluation report, with exception to BHWI, because that was the funding for that specific timeframe. And then the rural medical tax credit, because that's kind of out of our purview and we don't necessarily, oh, thanks, Ritu, sorry. Office of Management and Budget is OMB. And then lastly, a lot of the sections include some provider stories and qualitative data, which we got from ORH, which works directly with providers, and PRISM Data, which is a national platform to help collect that qualitative data. Next slide. Okay, we're going to get into the Healthcare Provider Incentive Program and doing a little overview of the programs included in this. So there's 5 key programs in HCPIP that we'll be going more in depth on. Our loan repayment program, where OHA directly sends funds to practicing providers to repay eligible debt. We had 42% of recipients identify as people of color or from tribal communities in this program. We also have the Primary Care Loan Forgiveness, or PCLF, which provides funds directly to students to offset the costs or loan costs in exchange for a service commitment. And 36% of recipients identified as a person of color from tribal communities in this program. We also have the Scholars for Healthy Oregon, or SHOE for OHSU, and the SHOE-like for non-OHU like training programs. And this contracts with those educational institutes to allocate funds through a grant, which the schools then directly distribute to students in the form of scholarships. And so for these programs, we had 21% of recipients identify as people of color from tribal communities under the SHOE program. And then we have a slight typo. We actually had 53% of recipients of the SHOE-like scholarship funds identify as a person of color or from tribal communities. And lastly, we'll be going into the Rural Medical Insurance Subsidies, which provides funds directly to insurance carriers to allocate to practicing professionals in the form of subsidies for primary care professionals in these rural areas. And we had 25% of people or recipients identify as person of color or from a tribal community. Next slide. Okay, we're going to be going into each of these programs in a little bit more detail. So the purpose of the loan repayment program is to support practicing professionals to repay qualifying student loan debt with tax-free awards in exchange for a 3-year service commitment at a qualifying practice site. And these professionals can always reapply for additional service commitment and loan repayment once they complete the service commitment. Full-time providers. This is, we pay for 70% their loan debt balance, and we'll pay for 100% if it's a lower amount. The maximum amount is going to be $50 per obligation, so $150 over the course of that 3-year service commitment. And then part-time providers is going to be half of that amount, so a total of $75,000 over the course of a 3-year service commitment. Next slide. Okay, there's a wide range and a currently expanding range of providers who are eligible for this program. So we have, and there should be a focus on primary care, but that can kind of go over a wide range of different provider types. So we have dentists, expanded practice dental hygienists, pharmacists, physicians, MDs, DOs, or NDs, nurse practitioners, and physician associates, kind of with focuses on these specific fields listed here. Also, it won't be included on the report, but there was an expansion in last summer and fall as we are expanding loan repayment eligibility to dental assistants and dental therapists, as well as behavioral health professions in a like kind of separate but similar behavioral health loan repayment program. And we'll be able to see that on the next evaluation. Next slide. Okay. And last, for the loan repayment side of things, all eligible provider types need to be working at an eligible practice site in order to participate in the program. So practice site eligibility needs to be either located in a health professional shortage area or HPSA, or have a facility HPSA, or serve Medicaid and Medicare patients at no less than the same proportion of patients in the county, or it needs to provide essential healthcare services to an underserved population as determined by OHA. And for all of the practice sites, they need to have a site application with the Oregon Office of Rural Health and have received a confirmation of site qualifications through them. I'm gonna go next slide. I'm gonna pass it over to Jill. Thanks, everyone.
Thank you, Kim. Apologize for not being on camera. My background is very, I've got a lot of sunlight coming into my room and it just looks like I'm an angel going towards the light. So please don't go towards the light to me today, but we're gonna continue on our presentation. And if you're listening to me, we're halfway through. So that's that's great. I'm Jill Boyd. I use she, her pronouns. I'm also with the Healthcare Provider Incentive Program, along with Kim. And we're going to continue to move right along and talk about the primary care loan forgiveness incentive. This is another incentive offered through the Healthcare Provider Incentive Program, and the intention is to support students that are on a primary care rural training track to practice in a rural community in exchange for a service obligation at a qualifying practice site. So some of the expectations are students need to be enrolled in a full-time education program. They're required to fulfill what we consider a one-to-one service commitment in rural Oregon, which means that students can receive up to 2 years of an award for loan forgiveness. And for every year that they receive the award, they have to commit to 1 year out after post-graduation to commit to practicing in a rural community. So they, if they receive 2 years, they would have to commit to practicing 2 years upon graduation. And this also includes providing a minimum of 32 hours, what we consider full-time, of direct patient care per week. And currently we have participation through OHSU, Pacific University, and the Western University of Health Sciences College of Osteopathic Medicine of the Northwest, commonly known as Comp Northwest. Next slide, please. These are the providers that are currently eligible for the primary care loan forgiveness program. We have a variety of different physicians that are specializing either in family medicine, general internal medicine, pediatrics, surgery, community psychiatry, gerontology, or obstetrics gynecology. We also have physician associate students that are eligible, very similar to the types of practices or specialties listed as physicians. We have nurse practitioners, dentists, and pharmacists students that are also eligible for this program. Next slide. In addition to the types of providers that are eligible, students must be enrolled in an academic institution that does not or will not discriminate against anyone from groups protected by law. At this point in time, we are not changing. No changes have been made in comparison to the federal guidelines right now. So we're still sticking around with the state rules for that. They must be in good academic standing, and this is the big caveat for this program is they must be able to participate in a rural training track. So either the Oregon Health Education Center AHEC Scholars Program or another accepted and approved Oregon rural training track. And we require that they begin practice at a primary care at an approved rural practice site within 90 days of graduation or completion of residency. And we communicate, I say we have our amazing partners at the Oregon Office of Rural Health that do a lot of the communication on behalf of this program, as well as many others. And they're the ones that provide a really strong communication with the student. So we kind of have a much better plan and understanding of what's going on as they get closer to graduation. Next slide. So along with student, very similar to loan repayment, along with student eligibility, we also have to have some practice site eligibility. For students that are going in, graduating and are going into practice, they are required to be located in a rural area as designated by the Office of Rural Health. They must be located in either a federally designated HPSA or health provider shortage area, or an MUA, which is a medically underserved area. Sorry for those acronyms, guys. Or an area of unmet healthcare needs as determined by the Office of Rural Health. And their clinic needs to be able to see the same percentage of Medicaid and Medicare patients that exist in the county in which the clinic is located. And I know there's a lot of ands in this one. They must have a valid site application on file with the Office of Rural Health that is no more than 1 year old. Next slide. All right, now we're going to talk about another incentive that's within the Healthcare Provider Incentive Program. This is the Rural Medical Practitioners Entrance Subsidy Incentive. This is one of our fairly older incentives that was originally launched under House Bill 3630 in 2003. And the intention is to support and stabilize the healthcare workforce in rural and frontier areas of Oregon. The purpose of this incentive is to provide partial malpractice premium subsidy payments to insurance carriers for physicians and nurse practitioners at independent practices. And the intention is really to focus on those providers that are located in rural and frontier areas in the obstetrics field, pediatrics field, and neurology specialties. And again, we do require that it's a year-to-year eligibility. So every year we expect providers to submit a yearly affidavit or to the Office of Rural Health. That also kind of helps us sort out who's eligible and who's not for this incentive. Next slide, please. Okay, so we have, so we work directly with the carriers. We rely on the Office of Rural Health to kind of help vet the providers that are eligible, but we directly work and provide invoices directly to the carriers, the insurance carriers. So carriers have to be eligible for the program as well, and this is under our Oregon administrative rules. They must have a certificate of authority on file with Department of Consumer Business Services. At this point in time, we do not allow surplus or excess line carriers to participate in this program. Carriers are required to provide their yearly rates and limits on a yearly basis, so we can kind of gauge our budget a little bit better and understand how many providers and if the rates have gone up significantly. We want to be able to monitor that over time. And then also submit invoices either on a monthly or quarterly basis, depending on the different types of carriers. And currently, this is our list of participating carriers, but we just added one more for 2025 that will not be included in the evaluation report. But we are slowly but surely adding new carriers. And if you're interested, you can always look at the comment section or the chat section that has more information from the Office of Rural Health about this program. Next slide. This is another incentive that is overseen by the Healthcare Provider Incentive Program. It's called SHOE, or Scholars for Healthy Oregon Initiative. This is a a initiative that we contract directly with OHSU to administer this incentive. It's kind of established in a separate statute, but it's kind of still enveloped within the healthcare provider incentive program. The purpose of this incentive is to provide full tuition and fees to OHSU students in 4 different clinical programs, and also in exchange for service commitment at a qualifying practice site. Students must be a resident of Oregon and either accepted into but have not yet started their first year of education at OHSU. And OHSU does give preference to individuals from a rural heritage status, and that's something that they vet out within the provost office. They must be a first-generation college student or individuals from a diverse or underrepresented community. Next slide. So again, students must be admitted to OHSU either as an Oregon resident or Oregon heritage student. And these are the disciplines. So MDs, DMDs, Masters of Physician Associates or PAs, Doctors of Nurse Practitioner with some specialty areas listed below. And next slide. So as with all of our other incentives, there is a practice service commitment requirement. So OHSU, I believe, has that 1-to-1 plus 1. So for every year of scholarship that the students receive, they have to commit to 1 year of practicing in a designated practice site plus 1 year. So for every year, they have a 2-year service commitment. And these are the different types of practice sites that are eligible to accept our SHOE students. We do allow students to practice in an urban community as long as they meet one of the following qualifications. I'm not going to list them all off for you. You can read them. And then in rural areas, very similar, including Veterans Affairs clinics, certified rural health clinics, and tribal clinics. Next slide. Okay, so this is another incentive. It's called Scholars for Healthy Oregon Initiative. For those of you who remember that, this was really adapted from the SHOE program to provide full tuition and fees to students that are not at OHSU through different education programs. So we launched that. This is our 3rd cycle that we're going into right now, but the first 2 cycles will be included on the evaluation report. So we'll have information about the awardees for the first 2 cycles. And then we've just launched into the 3rd cycle actually right now. And we've renamed it because we really didn't like SHOE because it really is while the intention is very similar, it really is different, and we're really expanding to high school students as well as other allied health professional educations, community colleges. So just to be clear, the information that's presented in the evaluation report will be for the first 2 rounds, which are non-OHSU educational institutions, community colleges, naturopath educational institutions, that type of thing. And because of that, so graduated students may be required to complete a service commitment at a qualifying practice site. Again, that's really dependent on how much award funds are given to students. If it's over $35,000 to support their full tuition and fees, then we do require a service commitment. But because there were community colleges that were included in these educational institution awards, then not everybody is going to be receiving needed to have a service commitment if we were only paying for a certificate program, phlebotomy program that didn't require a really hefty service commitment. The intention is to help expand and diversify the health professional workforce for this incentive. And as always, we want to operationalize the scholarship program that's aimed at increasing the diversity and representation and lived experience of our workforce. Next slide. All right, so we're getting near the end here, guys, I promise. We're getting very close. We're dipping out of the healthcare provider incentive program, but we do have two additional incentives that are part of the healthcare provider incentive fund. So it's a little bit tricky, but bear with me. This next one you might be really familiar with. It's How To, or the Healthy Oregon Workforce Training Opportunity. This was established in 2018, also under House Bill 3261, as a collaboration between the Oregon Health Authority and OHSU under the policy direction of the Oregon Health Policy Board. The purpose of this, this opportunity is to support grant making for innovative community-based healthcare workforce training projects, with a main focus on increasing diversity and culturally responsive workforce, to serve medically underserved rural and remote communities, and really to address the workforce shortages. So Melissa Yates, who I believe is on the call today, she's also in our team. She's the coordinator for this program, and she is knee-deep in cycle 6 right now. So she's been a very busy, busy person this month, as well as many folks that have been supporting her work. Next slide. All right, the Behavioral Health Workforce Incentive. This will also be included in the evaluation. However, it's not part of the Healthcare Provider Incentive Program, but was built in for one biennium under House Bill 2949 and 4071. That it was built into the Healthcare Provider Incentive Fund under a sub-account to help support increase the recruitment and retention of behavioral health providers. That's why it's also included in this report, this evaluation report for this this cycle. The programs that were included in this report, there's two main programs. It's the Oregon Behavioral Health Workforce Bonus and Housing Stipend Program. So we'll receive some information from the Behavioral Health Workforce Incentive Program on that offers practicing professionals sign-on bonuses, retention bonuses, and housing stipends. And then they also had a one-time funding in the 21-23 biennium under these two House bills to provide Oregon Behavioral Health Loan Repayment Program, which is a little bit different than the loan repayment program that Kim mentioned earlier in the slide deck. This program offered practicing professionals loan repayment in exchange for a 2-year service commitment at a public or nonprofit mental health facility or another underserved rural community facility. So slightly different requirements. We did not go into length in this slide deck, but we do discuss it further in the evaluation report for you to review if you have additional questions. Next slide. All right, this is our last our last incentive we're going to talk about today. It's the Rural Medical Practitioner Tax Credit. This is an oldie but a goodie. It's been offered since 1989 through the state tax code. The intention of this tax credit is to allow eligible medical providers who are working in a rural area to receive a tax credit between $3,000 and $7,000 annually to the following eligible providers listed below. This is not part of the Healthcare Provider Incentive Program, nor is it part of the Healthcare Provider Incentive Fund. However, it was built in under House Bill 3261, and it's facilitated through the Oregon Office of Rural Health. So we do include this information as well in the evaluation report, but it is definitely pretty separate than all the other incentives, and we honestly don't have very much control over what happens with this tax credit since it's all done through facilitation of ORH and, of course, the Internal Revenue Service. So I will say that one thing to note that you might see in the evaluation when you get the evaluation report is that the eligible providers can retroactively amend previous tax years. So we might see some significant fluctuations in the previous year tax information when these reports start coming out. So it's not always going to be the same information just updated. We could have some back information that we have to adjust in our presentation as well. Okay, let's move to the next slide, I think. Next steps and timelines. So we've already talked a little bit about the timeline. Kim mentioned that. Again, we're doing an educational overview with you all today. And if we can go to the next slide, Jessica. These are some of the things that we wanted to talk to you a little bit about around the structure and what we kind of want to ask of the Healthcare Workforce Committee. We spend a lot of time talking to you about our incentives, and a lot of these incentives are where they are today because of the support and information and passion that the Healthcare Workforce Committee has shared with us. We've really modified the way that we look at our Show We Like program because of kind of some of the discussion and the information that's been shared in these meetings. Same thing with the rural insurance subsidy program. If you remember, for those of you remember, we had this grants pass conversation because of the rural urban change that happened. And that was really, you guys provided some really great insight with that. So you do have an impact. You do kind of help support the work that we're doing and the changes that we could make for future incentives, modification of future incentives, disciplines that are offered. We always want to hear recommendations and feedback from the Healthcare Workforce Committee. Your input is very valuable to the work that we do. Having said that, because we did back in May of 2024, we did have you all, those of you that were committee members at the time, we did ask for feedback on what you would like to see in the report. We had about a 2-month time where people can provide input on what's missing, where they want some clarification from the last evaluation report. So that we can include in this new iteration for the 2025 evaluation report. So you're probably wondering, well, we haven't seen it. Well, you haven't. We're still working on it. We're finalizing the data now. It's been a pretty big, hefty lift. If you remember from the timeline, we started working about March, April of 2024. So it's going to be well over a year in getting this evaluation report done. And so we will share it with you. Hopefully before, we don't have an exact timeline, but you will be able to receive it before you participate in the Healthcare Workforce Committee presentation on May 14th, 2025. So we hope that you will have the opportunity to receive the evaluation report. Well, we will give you the opportunity to receive the evaluation report. That's my goal. And then we would love for you to review it, put your thinking caps on, think critically about it. Let's see if there's any edits that need to be made, anything we need to flesh out a little bit. And then we will put together all of that lovely data that's in the evaluation report into a presentation for you all for the May 14th, 2025 meeting. At that point in time, we'd love for you to kind of share with us your thoughts. If you have any questions, you can always email us. And then you're providing your recommendations to the Oregon Health Policy Board for approval. And then we will take the same presentation with any edits or modifications from the Healthcare Workforce Committee. We'll take that to the June meeting of Oregon Health Policy Board for their approval. And then we can get it published and get it going and have it be a permanent document on our website. So I will stop there. We can maybe go to the next slide is our questions and comment section. Just happy to answer any questions. I'm not quite sure where we are in time, but we are here to chat with you all for a few minutes.
Great. Well, thank you, Jill and Kim. We actually have some time right now. So I see, Megan, you have your hand up.
Yes, thank you. I had 2 questions. One was on the Oregon medical practitioners insurance eligibility. It said the primary focus of that was disciplines of obstetrics, peds, and neuro. Is that is family medicine not one of the specialties that's eligible for that insurance subsidy?
No, I apologize for that. So the intention behind this subsidy was to really focus, I'm going to take myself off video, was to really focus on rural practitioners that were providing obstetric care in in a rural community. Same thing for pediatrics and neurology, only because that's where there was a major shortage at the time. And so we want to make sure that we keep that in there, because we want to make sure that of the focus, we want to make sure that those that are providing obstetric care, providing pediatric care and neurology care, that we can support them to become eligible. But no, anybody that's a family medicine it's definitely eligible. We just to be clear, we offer 80% for any doctors or nurses that are specializing and or certified in obstetric care. So we pay 80% of their premium rates each quarter or month or whatever, whenever the carrier submit. We have 60% for doctors that are specializing in family or general practice who provide obstetrical care. So when I say we have our focus, we offer a higher percentage of subsidy for the carrier medical malpractice insurance for those that are providing obstetric care versus those that are providing family medicine, or even down to 15% for anybody else that's providing some sort of specialty care.
So family medicine doctors that provide obstetrics, would they then be eligible for the higher malpractice coverage rate? Because those doctors do have to pay
if they're
pretty high.
specializing or certified in obstetrics care, then they would receive 80% of the premium of the subsidy. They would receive 80% of their premium rates would be covered through the subsidy. Yes. But if they're a family medicine provider who just provide obstetrical services, but they're not certified or specialized, then they would receive 60%. And then 40% for doctors and nurse practitioners that are either in anesthesiology, family practice that don't provide obstetric care, general practice, surgery, geriatrics, internal medicine, and pulmonary medicine.
Thank you.
Yeah. And we could put the link to that as well. I think we might have, if you want to dig a little bit deeper, we can talk more offline if that's helpful.
Okay. Let's see. Dr. Weiser.
I just wanted to follow up on what Dr. Holland was mentioning, is that and Jill, maybe we just follow up offline, the three of us, because it's like I provide maternity care, but there's no additional certification needed for family docs to do maternity care or specialization. And so that's the question.
Gotcha. I'm trying to see. So the Office of Rural Health, and I see Joey on there. I don't want to put Joey or Bill on the spot, but I'm looking at our rules, and maybe we can talk offline a little bit about that. But the Office of Rural Health is the one that determines eligibility based on and determines the percentages on our behalf. So if there's something a little bit different, or if I didn't articulate that correctly, we definitely can talk offline and make those corrections.
I'm just going to say, I think that'd be a good idea, because in many rural communities, the only people that are delivering obstetrics care are family doctors, some of whom have done a fellowship, many of whom do C-sections, and they should probably be reimbursed at the 80%. So be nice to clarify that.
Yeah, and to clarify Rob's too, family medicine's weird in that we are the anti-specialty, and so
right.
You can do a fellowship in OB, and technically there's no additional certification that comes out of that, where other specialties, like their certificates, we just we don't do that sort of thing.
Okay, any other questions? If not, well,
Jill, do you see Ian has his hand up?
oh, I'm sorry, no.
Okay. Jill, just out of curiosity, you mentioned with the loan repayment, you had now included dental therapists and dental hygienists, and then some behavioral health providers. Can you be more specific on which behavioral health providers are going to be covered in that grant moving forward?
I can
Yeah.
answer.
Oh, yeah, go ahead, Kim.
I can put the link in the chat for the ORH website for that too. There's a wide range of folks who are eligible. So let's see, I can pop it in the chat too. But it is kind of behavioral health providers who might not necessarily be eligible for the typical, or the original loan repayment program, but have that behavioral health specialty. That are now eligible for that. I can pop that in the chat. And you can find that all the loan repayment eligibility on the ORH website because it is beautiful and amazing. And here we go.
And Ian, just to kind of go back to the loan repayment conversation. So if you remember in the slide deck, we talked about the Oregon Behavioral Health Loan Repayment Program. That was a one-time funding to provide loan repayment for behavioral health services in the 23-25 biennium. So we supported that process for 2 cycles. So we have 4 cycles per year. So we supported them for 2 cycles. And then the funding for behavioral health came back into the healthcare provider incentive program. So in the 23-25 biennium, we're actually rebuilding the Oregon Behavioral Health Loan Repayment Program that was occurring prior to the 21-23 biennium when the funding was still in the sub account, but was shifted to the behavioral health workforce incentive and had some federal matching stuff. And it got a little bit kind of messy a little bit in terms of how the funding was being distributed. And then now for the 23-25 biennium. So that's when we're referring to as it's kind of coming, where we're expanding on the behavioral health professions. We've actually already had 2 rounds of the behavioral health loan repayment cycles currently occur in 2024, but we couldn't include those in the report because they happened after our June 30th, 2024 deadline. So they will be in the 5th iteration of our evaluation report, but it's hopefully a little bit better explained in the evaluation report what occurred during the 21-23 biennium with some of that shifting. But for at this point in time, Kim, I think, is going to put, the loan repayment program in there. But I believe it's fairly comprehensive. I think the only things that we've been hearing that are not included is certified recovery mentors or peer support specialists at this point in time.
Got it. Okay, well, thank you. All right. Committee members, any further questions? Neela.
Yeah, I just want to kind of emphasize what Jill had said at the conclusion of the presentation, that if anyone has any further questions or would like to get more information, we're happy to meet with people offline, because again, we want you to feel really comfortable and confident when it comes to the presentation in May, which the Healthcare Workforce Committee is going to have an approval vote so that it can advance to the June 10th Oregon Health Policy Board meeting. So, we welcome, any questions, any feedback prior to that meeting and prior to when we share the final report with you well in advance, so you can have a chance to review that and all the data in that. And then we'll also spend, time going through that data in the May Healthcare Workforce Committee meeting.
Okay. So to loop this back around, this is another opportunity for the committee and committee members to actively participate in the process. I believe the next slide has contact information. Yes. So questions, comments, feedback can go to Jill or Kim. The healthcare provider incentives. Okay. Next slide. Once again, thank you very much, Kim, Jill, Neelam, for all of the information on the healthcare provider incentive program and the support that it gives to providers in the state. Looks like we've now hit a point where we're going to take a short break. Why don't we come back at 11 o'clock? We'll just make it easy to list.